Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. Today's lecture is concerned with the Ayurveda students, that is a Swasthavritta subject. In modern allopathic language, it is called as a PSM, Preventive and Social Medicine. But in Ayurveda, it is called as a Swasthavritta subject. This is a very interesting subject, and we are discussing the topics as per the syllabus of the students. So the students, they are requested to comment their expressions, and if they find any difficult question in the subject of Swasthavritta, they can immediately write it down in the comment box. I will try to solve those questions in the coming lectures. Now, some students, they have the examination from the 22nd of this January 2024, the first terminal examination. And for that matter, so these students have the syllabus of Swasthavritta only for the terminal examination. Please note this point, that paper 1 and only part A. So for all these students who are appearing for the terminal examination, please concentrate on the topic which I am telling you right now. There are, again write it down, paper 1 part A. Which are the important topics? First is the Swasthavritta, Prayojana and Lakshana. What is Swasthavritta? Swastha is healthy and Vritta is information. So to remain healthy, there is a information given by our Charaka, Sushruta and Vagbhata. That information. And what is the aim? What is the Prayojana? Swasthasya swastharakshanam aturasya vikar prashamanam cha. Whoever the healthy person, that should remain healthy. This is the Ayurveda's expectation. And whichever the patient, we should treat him. So first aspect is a prevention. Swasthavritta subject is more concerned with the prevention. And Kaya Chikitsa subject is more concerned with the curative aspect. Are you differentiating? So Swasthavritta, Swasthasya swastharakshanam, Kaya Chikitsa, Aturasya vikar prashamanam cha. Very clear. Swasthavritta prevention, Kaya Chikitsa curative. But Ayurveda is talking about Swasthavritta as well as the Kaya Chikitsa. Next will be, who is Swastha? Who can be called as a Swastha? So Sushrut has given the best definition of Swastha. Samadoshaha, Samagnishcha, Samadhatu Malakriyaha, Prasanna Atma Indriya Manaha, Swastha Itya Vidiyate. The person having the balanced homeostasis in dosha, bioenergies, vata, pitta, kapha, in the dhatu, sapta dhatu, rasa, rakta, mans, med, asti, majja, shukra, and mala, three mala, matra, purisha, and sweda. These are the sthula mala. And what are the sukshma mala? Kleda, Kleda. And next line is samadosha, samagnischa, samadhatu, malakriya. Agni is also important, digestive fire. Prasanna, Prasanna Atma, Prasanna Indriya, Prasanna Manaha. That person is called as a Swastha according to Ayurveda. Okay, and to maintain these, next chapters are second paper 1 part A, Swasthavritta Prayojan Lakshan. I have explained in short. Dinacharya, daily regimen. So this topic is very important for LAQ. Describe Dinacharya in detail. 15 marks. Please see my video. It is already been discussed. So you check that video, first few lectures. And then there may be breakup. They will not ask you complete Dinacharya. What they can ask, write down. They can ask Danta Dhavana Vidhi. They can ask Brahma Murta. What is Brahma Murta? Early in the morning. What are the benefits? Then they can ask Kaval and Gandusha. Very important. These topics are very important. Then they will ask about Ratri Charya. They can ask Sandhya Charya. So all these topics are important as a whole as well as with the fragments. Next topic, paper 1, part A, that is Rutu Charya. Very important topic. Seasonal regimen. There are 6 Rutu in whole year. You can divide it. Adana Kal and Visarga Kal. Adana is taking away of your healthy condition, making yourself weak, and Visarga, giving you the strength, giving the strength to the human being. So Adanakal is a Shishira Vasanta Grishma, Visarga Varsha Sharad Hemant. You will be asked in terminal examination. For example, this month is a December. What is the Rutu going on? Hemant Rutu, healthy season. Next Rutu is a Shishira, very, very chilled. Rutucharya of Hemant and Shishira is more same, is nothing to, very, very similar. But remember, they can ask you describe Hemant Rutucharya in detail. Describe Shishira Rutucharya in detail. 15 marks question, LAQ. I have the separate videos for each season in Hindi. Now, each student must check my playlist. There is playlist Swasthavritta class. This is very interesting. There are a lot of videos in the Swasthavritta class. So check all these videos very, very fast. Every day, at least 2 videos you should say from start to end and try to make the notes. Very, very quick. Next, paper 1, part A, Sadavritta. This is also important topic. Sadavritta, it is also called as a Achara Rasayan. There is important question, Dashavidha Papa. Please check it out. Try to find out the answer. And whenever you find any question is not in the video, any question you cannot find in your own textbook, immediately make the what's comment. Under the video, you make a comment, sir, please guide this question. Then I will make a separate video for according to your question. Next topic, paper 1, part A, Trayopastambha, very important. Udaharanartha, for example, describe Trayopastambha in detail, 15 marks. Yes. Describe Trayopastambha, 3 Upastambha, that is a tripod for our life. Ahara, Nidra and Brahmacharya. Ahara, food, Nidra and Brahmacharya. You should know about this Trayopastambha. Then they will ask you some Ahara Vargikarana. Then this is SAQ, LAQ. Ahara Vidhi Vidhana. Then next question, Viruddha Ahara. Very important topic. Viruddha, incompatible food. Mixing milk and fruits, not good. Then they can ask you Ashtau Ahara Vidhi Visheshayatana. Next, they can ask you about Nidra also. Anidra, for example. Very common. Anidra. Then 7th, paper 1, part A, Rogan Anutpadani. Very important topic. Na Vegan Dharayet, Vat, Wind, Mutra, Kshavatruchudam, Nidra, Kasa, Shramashvasa, Jirumbashru, Chardiretasam. So these Vegas, these Dharaniya, these are Adharaniya Veg. You should not hold. Whenever you want to go to toilet, go to the toilet. Whenever you are hunger, eat something. Whenever you are thirsty, drink water. That is called as a Nevegan Dharya. But, mental veg, if I'm angry, mental veg should be controlled. So in the oral they will ask, which are the Dharaniya and which are the Adharaniya. Read the question carefully. Mental vegas, Kama, Krodha, Lobha, Moha, Madamatsar, jealousy, anger should be controlled. But urination, go to the urine. Hunger, eat something. Are you getting the difference? Physical urges and mental urges. Physical urges, Navegan Dharani. Mental urges, Dharani. Very simple. Then Rasayan, very important topic. This is also in the Charaka. This is also in the Rasayana. So what is Rasayana? That makes you more energetic and more young. So Rasayan can be mentioned. There are 2 important topics. Kuti Praveshika Rasayana, that is in the health spa. Kuti Praveshika. Kuti is like indoor admission. And Vata Tapika Rasayan. Vat and Atap, wind and sun. That means we are regularly doing our jobs and all these things, and we are taking some Rasayan according to our Prakriti, according to our weak Dhatu, according to the season, according to the disease. These are the different types of the Rasayana. Okay. Then Ashtau Nindita Purush, very important topic for examination. Ashtau Nindita. 4 pairs are there. Too tall, too small. Ati Dirgha, Ati Rasva. Ati Sthula, Ati Krisha. Ati Gaura, Ati Krishna. Ati Loma, Loma, hair. Aloma. So these are the 8 problems which are more related with endocrine system, hormonal problems, and these are very difficult to cure. So this will be asked about sthulata. They can ask you sthulya, right? SAQ. Then they can ask you describe Ashtonindita in detail, LAQ. Okay. Paper 1, part A, last topic is a menstrual hygiene. For example, that pads, the ladies take, the cleanliness is more important in the menstrual cycle. Physical cleanliness, mental cleanliness, proper rest, all these things are very important, and that you have to describe. Okay, this question is important. Now I will tell you the question related with the terminal examination. Paper 2, now paper 2. Open paper 2, part A. We have also seen many topics. These are all topics important. For example, first is a Janapada Dhamsa. Janapada Dhamsa. Corona pandemic. Whole world is suffering. Then there may be epidemic. There may be endemic. So these 3 types. Then what is the main cause of Janapada Dhamsa? Adharma. Please write down this word, adharma. Not properly behavior of the society and administration and the government, all these things. Uncleanliness and the polluted. 4 things are important. Vayu, Jala, Desh and Kala. These are very important. Vayu, Jala. Vayu is air. Jala, water. Desh, area. And Kala. So these are the factors which can cause Janapada Dhumsaka Vyadhi. Paper 2, part A, Vayu, air. All these topics we have already videos. Please check these videos again and again. Make a screenshots, make the notes, start studying. Any difficult question, write it down in the comment. Okay, Vayu is the air. I am talking just topic. Jala, water. So they will ask you what are the effects of air pollution, what are the diseases because of the Dushita Jala, how to purify the water, all these questions, SAQ. Bhumi and Nivasa Sthana, land and housing. I am taking paper 2, part A. Prakash, lighting, Dhvani Pradushan, very important topic. Many times question asked, what are the effects of noise pollution, Dhvani Pradushan? I have the video. Check it. Vikiran, radiation. Then Apadravya Nirmulana, disposal of solid waste. Mala Nishkasana Vyavastha, excreta disposal. Shava Vinash, disposal of dead body. Each video is already existing. Then Rutu Evam Vatavaran Jnanam, meteorology. Disaster management. Yes, video is the disaster management. Occupational health, very important topic. Occupational health. School health services. And now, today also and last few lectures, we are studying epidemiology. Epidemiology, how the disease spread in the society and how to control that particular disease. Then there is some topics, paper 1, part A, that is non-communicable disease epidemiology. And last is a Chikitsalaya Bhavana, hospital building, how you can construct. So this is all for this terminal examination. Paper 1, part A, paper 2, part A for the terminal examination of the students. So now let us start with the epidemiology. Dynamics of disease transmission, how the disease is spread. First, source or reservoir of infection. What is the original cause? Reservoir. Please write down the keywords, K-E-Y. Keyword means very important words. Don't write anything else. Only I will tell you the word. This word is important. Reservoir. Only write down this thing. First, you write down title also. Dynamics of disease transmission. Please write down dynamics of disease transmission. The topic is, or other word, keyword. Key means, what is the keyword? Always you say keyword. What is keyword? Important, very important word. These words you must write in the examination and must tell while giving the oral. Reservoir, what is reservoir? Any person, individual, any animal, any object or material in which the infectious agent, that means bacteria, viruses, multiply 1 ka 2, 2 ka 4 and develops, and upon which it depends as a species its survival in nature. So forget about all these things. What is reservoir? From where you can get the infection. Suppose I have visited to a much mall and the crowd, too much crowd, and some people has some tuberculosis and he is always so I go near to him, that particular droplet of Mycobacterium tubercle will enter to my nose and go inside. Do you remember in the corona period, there was always a spray. We spray everywhere, on the books, on the tables, on the chairs. Why? Because we are worried that particular chair may remain that virus, coronavirus, few times, and then we can get, if we sit over there, we will get the corona. Am I right or wrong? That is here material. Some from animal. You know, the dog bite, rabid dog, we get the rabies, snake bite. So some infections, some problems we can get, even allergic conditions. Some people are having the cat, pet cat, PET, pet cat, and always they're like, oh, money mau. But that can give you the allergic asthma. So that is reservoir. From where it is coming. Next, we will go further. How we get the illness, okay? First part is mode of transmission, how it is spreading. Some diseases are direct contact. Suppose the child go to the school and his friend is having scabies. You know the scabies, very unhygienic. And if he make a second, hello, how are you? Then that scabies, what is the organism, they will enter into the healthy student. And he will also start scabies. Most of the time, scabies is a skin disease which spreads whole in the family. Are you getting? So this is called as a direct contact. Then droplet, just now I have some example. This is droplet infection, like a tuberculosis, flu, influenza, contact with the soil. Some infections you can get from the contamination of the soil. Then inoculation, some tricks are there. We can get the infection. HIV, for example, if the patient, some person has HIV and that needle is not disposable syringes. Now many doctors are taking good precautions. I'm not blaming to the doctors, but by chance, who are the drug addicts? You know, the drug addict, ganja, charas, etc. They get intravenous also. So there are the group of people, these drug addicts. They take the syringes of each other and pick it. That is called as inoculation. Transplacenta. You know the placenta? We have learned it. In Stri Roga Prasuti Tantra. From mother and fetus, it is connected with the placenta. So infection can go. For example, HIV infection can come to the baby. Hepatitis B infection can come to the baby from mother. Just remember these examples also. Okay. Now I am talking about the indirect transmission. How the disease can spread from one person to another. Okay. The spread mainly takes place by 5F. Very interesting, very important. Please write down. There are two types of transmission. Keywords, direct and write down indirect. Write down quick, direct and indirect. Then indirect, you write down 5F. Please write down 5F. Remember 5F. What are the flies? You know flies. Fingers, unclean fingers, vomit, vomiting. Vomit is a vomiting. Food and fluid. So these are the indirect ways of getting the infection from one person to another. Please write down in your notebook 5F. I will wait. First F, flies. आम्ही त्याला माशा म्हणतो, माशा. It also includes the mosquitoes, etc. Then 2, second F, here you can see fingers. Write down, fingers. Vomit. food and fluid. Fluid means IV fluids. You know that IV fluid, saline, normal saline, dextrose saline, various fluids are given. Sodium, potassium, even sometimes plasma, blood. So vehicle-borne, vector-borne, airborne, vomit-borne, and unwashed hands. These things, these are here simply mentioned. So you forget about this. You can write down these 5. Best, simple to remember. 5. We will go further. I think I have to make my screen on the right side to get a new information. Okay. Just wait, just wait. Very interestingly, we are studying all these Swasthavritta topics and we are talking about the epidemiology. Very interesting, epidemiology. Okay. So now we will talk about host. Please write down this word, very important. Host, H-O-S-T, host. Host. Host is a person or the animal that gives a shelter or place to an infectious agent under natural conditions. Are you getting this word? That means the person who is carrying the infection in his body. I am a tuberculosis. Example, I don't have tuberculosis, but any person having tuberculosis, so he is a host. Okay. Another example, some person gets the HIV, AIDS. He is a host and he can get another infection also because of the less immunity. Are you getting my point? So host is a person or the animal which gives the shelter to the bacteria. मराठीमध्ये आम्ही त्याला आसरा देणं म्हणतो. Or living place. Come and sit in me. Or go into my body and stay over there. Host is always having less immunity. Please write down this word, less immunity. I-M-M-U-N-I-T-Y. Weak person. So he can give the shelter to the malaria, for example, can spread one person to another. So this shelter giving is the person is or the animal is called as host. Next we will talk about disease. Please write down the title. Keyword. This is a keyword. In Ayurveda it is called as vyadhi. Vyadhi. Disease literally means, here you can see, is an opposite word is a dis-ease. Is opposite word is a dis-ease. So what is ease? Comfort. Oh my God, I am very happy, comfortable. That is ease. But today, if I am having a running nose, see, today I will speak with you in a very low because I am ill. That is called as uneasiness. Now I am very easy and fresh. That is ease. But when I am get some problem, that is called as uneasiness. While teaching, while learning, the student can be uneasy because of the gas in the stomach, constipation in the morning. So uneasiness. Can you get it? Ease is a comfortable. Ease is a comfort. And dis-ease is uneasiness, no comfort. Patient is always irritated. त्याला भयंकर बहुत परेशान हो जाती है वो लड़का जो जिसको भी डिसीज है ना, जिसको भी प्रॉब्लम है, कुछ भी हो, चाहे वो फ्लू हो, चाहे वो कैंसर हो, चाहे वो डायबिटीज हो, परेशान रहता है बंदा, वो उसको बोलते हैं डिसीज. डिसीज इज द स्टेट ऑफ द बॉडी, आइदर होल बॉडी और सम पार्ट. Only running nose, I don't have any other problem, no stomach problem. Then on some part or organs of the body in which the functions are disturbed. Suppose I get the jaundice. Simple example. Jaundice is a disease of liver. Okay. So whenever my liver is damaged, I cannot consume the fat substances, fatty substances. Are you getting my point? So that condition is affecting the liver organ. So you have to choose some different examples. Now, we will talk about infection. What is infection? I have got the flu infection. I have got the tuberculosis infection. I have got the gastroenteritis, vomiting and diarrhea. There is some, many of the problems are in the India, at least, I am sure. There is a comparison in the foreign countries and India. In the foreign countries, non-infectious diseases are more. Try to understand. There is very cleanliness. So they will not more time suffer from the infectious problems like malaria, tuberculosis, gastroenteritis, no. But they suffer from non-communicable diseases. Please write down this word, non-communicable diseases. Huh? They will suffer from obesity, foreign. They will suffer from cancer. They will suffer from diabetes. These are called as a lifestyle disorders. Please write down. I will wait. LIFE, lifestyle disorders. Lifestyle disorders in the foreign. That is not non-infectious. But here in India, infectious disease, because 140 crores is a population, huge population, and huge density. We have the less land. Are you getting my point? Land, very crowded. And so one person giving infection to the other person. We are still now, okay. I respect India because Swachhata Abhiyan, Swachh Bharat Yojana, PM Modi Saab, very great. But still in some rural areas, in some what you can say, crowded areas, there is a not proper cleanliness. And that is why we have the air pollution, we have the land pollution, we have the water pollution, we have the food contamination. All these words are important for the infection. Let us see the definition. Entry, Mycobacterium tuberculosis, and development or multiplication of an infectious agent in the body of man. Forget about animal. We are only concerned with the man first and then animal. So first is the entry and then multiplication. So you write down three words: infection dash bacteria. Write down BACT dash entry and dash, not only entry, multiplication of the organisms. Multiplication word is very important. Okay. So we are talking about Swasthavritta epidemiology. Don't forget it. See the video till the end, and not only once, 100 times. All Dr. Deshpande's classes videos are excellent. And share with your friend. Don't be very selfish. Get knowledge spreading is very important. Okay. Now, this you must make in your notebook immediately. So, epidemiological triad, SAQ question, short answer question, 3 marker. 3 mark, write down 3 marks. Epidemiological triad means 3 things. Which are the 3 things important? I will see. Start should be here. Agent. The agent means bacteria. It will enter first. Of course, I forget that bacteria will start from the environment. Polluted, contaminated air environment, the agent will be there, and that agent will come into the host, and host is always in a contact with the environment. So all these 3 together makes a problem of disease. These 3 things are very important for the formation of disease. So they are called as a epidemic, and that is spread of the disease. Epidemiological triad: environment, agent, and host. Environment, agent, host. These 3 words are very important. Okay. Now I think I should go for the next page, and on the left side first. First I will go here. Okay. Now you can write down the keyword, my dear friends. Come on, quick. And you can simultaneously make this, always make a habit of making screenshots. Always. It is possible. When you see the videos, there is one snapshot. Please write down snapshot. Snapshot is very important. Natural history of the disease, pre-pathogenic phase and pathogenic phase. Please write down natural history, how the disease develops from 0 to 100. Disease development 0 to 100. How it is happening? First is a pre-pathogenic phase and then pathogenic phase. Please write down natural history of disease. Very simple. Now, we will try to talk about concept of control. So, Please, we will, you can easily write down, very simple. I am not very fast. Concept of control. We want to control the disease. We don't want to spread the tuberculosis. We don't want to spread jaundice. We don't want to spread any filariasis. We don't want to spread the scabies. Any contagious communicable diseases that we don't want to spread corona. So what we will do? So that is called as a method of two steps. So first is a disease control. First you write down disease control, that is disease eradication. So there is a concept of prevention. What is that? Concept of pratibandha. Prevention is always better than cure. Prevention is always better than cure because there is a saving of the energy, of the money, saving prevention of the complications. The disease can be very well prevented. 3 levels of prevention. Please write down 3 levels of prevention. First is a primary prevention, that is during the pre-disease. Primary prevention. So primary prevention means during the pre-disease. Secondary prevention during the latent disease, and tertiary prevention during the symptomatic stage. Please write down primary prevention. I will explain you. Don't worry, be happy. So level of prevention. What you have to write down in the notebook? Come on. Levels of prevention. First, I am dictating you. Please write down. Cursor is here. Primary prevention. When it is to be done? During the pre-disease. I will tell you now how it can be done. For example, rainy season is there. Okay. In the rainy season, there are a lot of mud and dirty conditions. All things are very dirty, at least in India in the rainy season. Roads are problematic. Okay. We cannot dispose of our kitchen waste and all these things. So organisms grow very fast because of the humid climate. Clay is there. Okay. So during the I know that now the rainy season has started. The water will be contaminated. Okay. And there may be chances of jaundice. Take one example. Write down example. Jaundice. So how I can primary prevention takes place? I will try to see each and every day. I will take only boiled and cooled water. First, you have to make whatever drinking water 20 minutes boiling. Must. Minimum 20 minutes boil. Then little bit room temperature and then only drink. Whole of the rainy season. June, July, August, September in India I am talking about. If each person is taking to care, that water will be only boiled water. Then second, anything outside food is not allowed. Only homemade, freshly cooked food one must take. So first care about water, second care about the food. That is, I don't have any jaundice. In my Kapila society where I am living, there is no case of jaundice. But still, this is called as a pre-disease. Disease is not there. But I want that I should not get jaundice. That is drinking boiled water, eating homemade food, no outside food. Is it clear? Then secondary prevention. During the latent disease. What is latent disease? There are some, my neighbors, they may have started the problem of jaundice. And I am very, what you can say, the sensible that I can get a disease. Then immediately I will start, for example, Arogyavardhini tablet of Ayurveda. Or Himalaya company, leave 52 tablets. 2 tablets, morning and evening I will start. That is, the disease is not yet clear. Purva Rupa in Ayurveda, or a little bit warning signals. So this is a latent disease. Ready to attack. That is latent. Ready to attack. That is latent disease. I will start some rasayana for the liver. And tertiary prevention. During the symptomatic. Now I have started little bit anorexia, a little bit what you can say, nausea sensation. Then I will add a little bit more medicines like Arogyavardhini and Kumari also together. Then I can try to control my symptoms as earliest as possible. So there are 3 stages: primary prevention, secondary prevention, and tertiary prevention. Now, how we can, whenever the disease is there, how we can manage? This is called as a modes of intervention. Please write down. These are the keywords. Whichever the words you see on the screen as a bold, whichever the words you see on the screen as a bold, please, they are called as the keywords in the examination. They are the titles of the paragraph. And these keywords, if you don't write, you will not get the marks. Keywords are very much, you make an underline. Don't forget to underline. Here we can make the bold. This is computer. But for the examination answer sheet, my dear friends, make underline always. And after, here you can see, just a moment, I will tell you. This, after this discussion, can you see some space over there? Similarly, when you write the question, always after one paragraph, you make one line blank, so that the teacher will understand, okay, this point is there, this point he has written, this point he has written. So we must tell him that I have written for LAQ 10 points, sir, and they are underlined. Very important. Presentation is always important in the examination. Don't forget my words. Modes of intervention. First, we will try to health promotion. Just now I have told you, follow the dinacharya, you follow the rutucharya, you follow the Swasthavritta. That is called as a health promotion. Remember, write down. What are the examples of health promotion? Dinacharya, Ritucharya, daily regimen, seasonal regimen, ethical regimen, cleanliness, Trayopastambha, Ahara, Nidra, and Brahmacharya. This is health promotion. We want to build our immunity. Health promotion, building of immunity by giving some rasayana, Chavanaprash, health promotion. Then, specific protection. Just now I have mentioned specific protection to prevent the jaundice, boiled water, homemade food only, that is specific protection. Are you getting my point? Then early diagnosis and treatment. You must, whenever you have any suspicious, patient comes to you, doctor, the last 2 days I am feeling very, very nauseating, and since last 5-6 days I am not feeling to eat anything. Kaman lati iti kamala. Doctor, I don't have any desire to do something, anything. Very sad, sir. What to do, sir? What to do, sir? That is called as, you may suspect. Oh, do you have any patient in your neighborhood? Any jaundice? Yes, doctor. 2 Bangalows further, I have family having a jaundice. Oh, have you visited to that? Yes, he is my friend, sir. He is my friend. Just 4 days, I have a very chat and interesting tea and coffee. Oh, I see. So you suspect that this person may be getting jaundice, infective hepatitis virus 1A. Immediately ask him to do urine routine examination, where you will get bile salt and bile pigments. Stamp, attack, jaundice, early diagnosis. Then afterwards, you can also take care that do the blood test, serum bilirubin level will be high. So this is all. And immediately start Arogyavardhini and Kumariaso. These are the best medicines for infective hepatitis virus A. Please try it. 3 tablets of Arogyavardhini morning, Arogyavardhini 3 in the afternoon, 3 in the evening. Yes. I am telling you, infective hepatitis virus A. I am not talking about prevention. So high dose is required. I have made a research on it. Yes, confident. Arogyavardhini plus. Don't write out. Kumari Asava, Corford aloe vera. Kumari, Kumari, Asava, number 1. There are 2 types of asavas. Kumari Asava number 1, Kumari Asava number 3. But this is Kumari Asava number 1 with Arogyavardhini 3 times. 4 teaspoons of medicine, 4 teaspoons of water 3 times in a day. You do it, and all the symptoms of jaundice will be very early cured. Bilirubin level will be come down fast. My promise is there. Don't worry. Then next, disability limitation. Suppose, for example, patient has problem with the hemiplegia, paralysis. So we have to start immediately some therapy, physiotherapy, that is to avoid the disability. For example, if the patient is having rheumatoid arthritis, then there is always joint contractions. So always ask him to do some oil massage, snehana and svedana for the disability limitation. We want to prevent disability and the rehabilitation. Whatever the damage is there, we have to do something to improve his quality of life. That is called as a rehabilitation. Next. Very interesting. Epidemiology, Swasthavritta, we are learning. Incidence and prevalence. Keywords, write down. Incidence and prevalence. Always oral, they will ask you, what is prevalence? What is incidence? So, incidence is the manifestation of new cases of particular element in an area during a definite period of time. You know, always whenever there was a corona, they were always talking. They were always talking about what? How many cases in the Pune city? How many cases in the Bombay? How many cases in the these different areas? Nagpur, Delhi. So this is called as incidence, occurring, the manifestation of new cases. Please write down. Only short, don't write anything. Manifestation of new cases of particular disease. You can write down particular disease. Then prevalence. Prevalence means both new and old cases. Please write down. For example, in the 2019 and 2020, 2 years, you consider 2 years, then you make a data, how many cases were there in 2019 and how were there in the old. So mixing of number. So new cases are, for example, only 50, but previously it was 100. So 150 is a prevalence. Okay. So 2020, what will happen? This 2019 150 plus 2020, it is again 100 cases more. So total prevalence, occurrence in 2020 is mixing of previous plus old plus new. So in the notes you write down, prevalence means old plus new number. It is the number of the patients, incidence and prevalence. Now I will have to move on the right side of the screen. So just keep patience. We are learning epidemiology, Swasthavritta paper 2. Swasthavritta paper 2 part A. We are learning epidemiology from Professor Deshpande in the lecture of Swasthavritta. No. I think this we have seen. This is prevention. No. This is not we have seen. Please write down this one. Disease prevention and control. How we can prevent and how we can control the number. Okay. Links required to break for prevention and control of disease. So there is a linking. Linking of what? Reservoir, source of infection. Then second, modes of transmission. And number 3, susceptible host. I will wait. You write down all these things. We are discussing this much part. Screenshot or write down. Comfortable, relax. We have the time. Disease prevention. We are talking about disease prevention and control. Again, take the same example of corona. First, reservoir, source of infection, patient, infected patient. You know that is a period of separate, making the separate, patient should be having a separate room, separate arrangement for food, all this separation is there. Do you remember that corona period? Patients were kept separately. Their hospitals were separate and all the protective kits were there for the doctors and the nurses and the ward boys. And then they only go to the room. Separate rooms, separate hospitals. You know this. That is called as a, we want to find out source of infection. Then mode of transmission from one person to another. We have to check that one. that patients are not allowed quarantine. You know this word? Remember? Quarantine. नहीं नहीं, पहले तो हॉस्पिटल में क्वारंटाइन करते थे, अभी घर पर चल रहा है क्वारंटाइन, क्योंकि संख्या बहुत बढ़ गई है ना, ऐसे बोल रहे थे हम उस टाइम. So that is all these things, modes of transmission and susceptible host. Do you know this thing? What is susceptible host? Those having the comorbidity. Immunity is low because of the another disease like diabetes, another disease like heart problem, another disease of lung like asthma, another disease like the lung cancer. These patients are having more danger of getting corona. So this is susceptible host. These weak immunity patients. Okay. Now, steps required to control the reservoir. That the origin, we have to control that origin. First is the early diagnosis. That's why, you know, the government is always thinking, make the more test, more testing, more testing, corona, more testing. What is that more testing? That is early diagnosis. Then immediate quarantine. Then notification. I remember in those days, so everywhere, so people are conscious. Government is conscious that notification. If somebody has a corona patient in their home, the municipal corporation, they make a board over there. This person, this family is having corona patient. So the neighboring, they are taking care. Oh, not to walk through that particular road. Yes, I remember. This much was the precautions taken during the time of corona. That is a notification. Immediately informing. For example, now there is a patient of, say, example, the jaundice in the school. Then that particular headmaster or the principal, they intimate to the concerned class teachers, see that this student should not be allowed from the tomorrow, and ask all the other patients take the vaccine. So this is called as a notification, information. Then epidemiological investigations, that you know very well. All the time we do start investigating. Different tests are done for the different diseases. Of course, that is very clear. Different tests for the different diseases. Isolation. I think this is very now well-known word, the whole world by the corona. Isolation is a separation of the patient. Then quarantine. Some specific days. At that time, I remember, I think the quarantine was minimum 15 days, if I remember properly, or 3 weeks, minimum 3 weeks. Now, the slowly they come down. Now only 8 days quarantine is enough. This time, but first time it was 3 weeks quarantine or 1 month quarantine. Whenever the foreigner comes, then he was kept in the hotel for minimum 1 month. That is called as a quarantine. And the proper treatment, immediately they start some specific medicines for the specific diseases. Okay. What we can do, another things to prevent the diseases. Okay. So step by step, we will see only these things. Steps required to prevent the disease. Prevent what? To prevent the disease in the susceptible host. What we can do? Suppose, for example, the old people are in the home. Then we will protect them first. Give some vaccines, corona vaccine or other vaccines. Then immunization may be active, immunization may be passive, immunization may be combined. Okay. So, for example, tetanus toxoid, taking this injection to prevent dhanurvat or tetanus disease. What we do regularly, we periodically take TT, but that is called not as a active, that is a passive immunization, because we are developing some antibodies after some period. But for example, if there is a serious accident and lot of contamination of the soil is there, dirty things are there, wounds are too much wounds, then the person is given ATS, that is anti-tetanus serum, and that is the active type of immunization. Immediate antibodies are given to the patient. So immediate giving antibodies is active, and developing the antibodies by the patient himself or the person himself is called as a passive. Then chemoprophylaxis, casual and clinical. Chemoprophylaxis, can you understand what is meant by chemoprophylaxis? Very simple. First is a casual, drinking water, boiled water. That is a casual type of prophylaxis. or giving some normal Lu-52. But clinical chemoprophylaxis, specific antibiotics, specific medicine according to the disease, that is called as the clinical chemoprophylaxis. Non-specific measures, which are common for many diseases. It is not only for corona. It is for washing your hands properly at every time. This is sanitation. Then taking proper quantity of proteins, proper quantity of carbohydrates, proper quantity of fats. This is called as a nutritional your status. So we must, that is nothing to be depend whether you have the corona, whether you have the tuberculosis, whether you have the jaundice. No, everyone should care about the sanitation. Everybody, every patient of any disease. That's why they are called as a non-specific measures. They are not dependent on any particular disease. They are for all diseases. That is education about the disease, how it can be spread, where mosquito nets and all these things. So this is a specific education according to the conditions that we must give. I think we must go on the next page. Of course, on the left side, I have to move. Okay. Now more discussion about isolation. This is the keyword. You can get SAQ, short answer of 3 marks. What is isolation? So this question, write down, very important, isolation. Defined as a separation, I just now mentioned, corona patient, separate, for the period of communicability of infected person or animals from others. Forget about animals, others in such places and under such conditions. Previously, it was admitted to the hospital directly. Now, afterwards, when the hospitals were full in the corona period, now they ask patient to stay in the house, but in the separate room. Under such conditions, to prevent or limit the direct or indirect transmission of infectious agent from those infected person, that is patient, to the who are susceptible. We were always taking care at that time of the small children, like infants below the age of 1 year. Very old people, we are taking more care of them, and who may spread the agents to the others. For example, if the person is having always traveling, then we have to take care that he should not go to that patient's room. That is called as isolation. So whole of this definition you try to learn by heart. याद करने की कोशिश कीजिए, क्योंकि आइसोलेशन पर एंड नेक्स्ट क्वारंटाइन ऐसे क्यों आने वाला है आपको. 3 मार्क्स होते हैं सिर्फ, तो आपको ये 4-5 लाइन पढ़ के पूरी याद करके लिखना है, बस रट के लिखना है उसमें पेपर में. ठीक है. आइसोलेशन इज अ वेरी इंपॉर्टेंट टॉपिक फॉर एसएक्यू एंड क्वारंटाइन एज वेल. सो प्लीज write down quarantine. Quarantine, what is quarantine? Definition: limitation or restriction of the movement of such healthy person or domestic animals exposed to the communicable diseases for a period of time not longer than longest incubation period of the disease in such a manner to prevent the effective contact with those who are not exposed. Do you remember quarantine word? Whenever the foreign from the any person at that time, 2019, 2018, whenever it comes land on the India, immediately on the airport itself, you can give these examples in the examination answer sheet also. Also, it is allowed. So at that time, airport, they always check a report, whether you have done PCR, whatever that RT-PCR, etc., all these tests. And if somebody is found susceptible, they immediately ask him to put it in the separate vehicle, take him to the different hotel and ask him to stay in that hotel. That's it. That is called as a quarantine. Because limitation or restriction, this is what is important of the, he cannot mix with the family members. Although he is coming from the foreign, even you disposal of the dead bodies was a very crucial at that time. But that is not related with the quarantine. Just I am talking about limitations. Healthy person, movement of the healthy person exposed to the communicable diseases for a period of time not longer than longest incubation period of the disease. Okay. Next. Investigation of epidemic. This is the today's last point that we want to discuss. Just give me some time to mark this. Okay. Write down this title at least, investigation of epidemic. Determine the existence of an outbreak. Oh, this साथीचा आजार, चला टायफॉइडची साथ आलेली आहे. There is a epidemic of typhoid. There is epidemic of jaundice. There is a pandemic of corona. So determining the existence, then confirm the diagnosis by test. Define a case, which is a patient, who is definitely 100% patient. Search for the cases. In whole area, all the people are asked to do the urine examination for bile salt and bile pigment to rule out whether he has a jaundice or not. Search for the cases. Generate hypothesis using descriptive findings. Some hypothesis, okay, whenever the patient is having nausea, vomiting, mild fever, anorexia, this particular may be having jaundice. So this is called as a generate hypothesis. Then test the hypothesis with an analytical study. Same again, take a, say you have found out that 10 persons are having anorexia and nausea. Okay. This is generated, and I feel that this patient may having the jaundice. This is my hypothesis. But then test. These 10 people should be done bilirubin test or the urine bile salt bile pigment, and you can find out, oh, no, only one case is there of that jaundice. So nothing to be worried about. Only these are the symptoms. Okay. Draw the conclusion. But if you find that out of 10, they are having the 8 people, 9 people having with this problem of bilirubin and bile salt bile pigment, then you can decide, okay, whole this Kapila society or area is suffering from the epidemic of jaundice. Communicable finding, that is a notification, that's now we have discussed, and execute immediate prevention measure. All the society members will be decided. There are 50 Bangalows, only the 10 are suffered. Now, remaining 40 were informed, notification. Okay, we have the epidemic of jaundice. Start drinking boiling water, eat only homemade, freshly cooked food, not outside food, etc., etc. So this is called as a preventive measures for the remaining 40. I hope that this lecture is very interesting, understanding the epidemiological problems, and you will be definitely benefited by this particular dynamics of disease transmission. So thank you very much. We will meet in the afternoon at 3 to 4 lecture of Charaka Samhita Chikitsasthan. Thank you very much. Take care and see you soon.